Okay, let's start discussing this case in English. We have a patient that's undergoing orthodontic treatment, and we have an impacted tooth in this location. So with regards to impacted teeth, it's very important that these cases are treatment planned with the orthodontist. The reason is because the orthodontist is the best person to decide when is the proper time to expose the impacted tooth based on the treatment plan and the movement of the teeth. And second of all, usually at the time of the surgery, the orthodontist will ask us or the orthodontist himself will be placing a button and a chain on the tooth. So this is why these surgeries need to be done with your orthodontist. The second thing is that if the patient oral hygiene is not very good, there's a lot of plaque and gingival inflammation, I recommend delaying the procedure because you're going to have a lot of bleeding during the exposure, during the surgery, and also the healing and the post-operative discomfort for the patient is not going to be great. The third thing I wanted to talk about is before we do the exposure surgery, it's very important to do your clinical exam and radiographs and maybe CBCT to determine the exact location of the impacted tooth within the arch. You want to know if it's buccally positioned or lingual, if is it more high up, just covered by gingiva, or is it very deep, covered by bone, just so that you can properly plan the surgery and you can decide which technique to use. And with regards to this case, I already mentioned where is the impacted tooth located with respect to the ridge. So we know that it's buccally positioned and we know that it's slightly deep. It's not at the crest of the ridge. Okay? So now the question was, which technique would you perform? Would it be a window with a blade? Would it be a window with laser? Or would it be open flap in order to reach the impacted tooth? Let's talk first about the window technique. Whether it's a blade or laser, it's gonna cause the same problem. The problem with the window technique is that if we cut and remove this tissue right here, we're going to lose a lot of keratinized tissue. And we know how important it is to maintain as much keratinized tissue as possible. So that's the first problem. The second problem is that after we remove this tissue and the tooth is exposed and the orthodontist comes and places the bracket and the chain and starts to pull up the tooth, the gingival margin that's going to be surrounding the canine is going to be mucosa. So we see this red tissue here, the red mucosa. That's the tissue that's most likely going to follow the canine as it erupts up into the arch. And then we're going to have a mucogingival problem here because we're going to have a canine with mucosa. That's not something we want to create. That's going to cause problems in the future for the patient. It's going to be sensitive to brush and it's going to cause other problems. So this technique, the window technique, in my opinion, is not a good approach for this case. So in my opinion, open flap is the technique of choice for this case. And then once we open the flap, we have two ways to manage the tissue. So if we open the flap, we can remove tissue and bone that's covering the canine, the impacted canine. And then there's two ways to manage the tissue. We either can do an apically positioned flap, which means that we take this tissue and we suture it deep down here. The problem with that is that because the canine is deep, that means we have to do a lot of cutting. We have to do vertical incision here most likely and vertical incision here in order to be able to place the tissue low enough so that it can be beneath the bracket. Because remember, we're going to have a tooth here exposed, we're going to have a bracket in the middle. If we want the margin, we have to place it all the way below the bracket. So this means we're going to be disrupting the mucogingival line here, the mucogingival junction. And we're going to have to place verticals and do a lot of suturing. It's going to be more painful for the patient. And the healing is going to take longer. And then when it heals, it's going to, I'm not sure exactly how it's going to look after it heals. It might look okay, but it's not the recommended technique. There's an easier way to do it. The easier way to do it is to do a closed exposure. So we open, we clean tissue and bone, and then we place the chain. The chain comes out, and then we suture everything closed. So that's the technique that I did. As you can see here, this is after we opened. We removed tissue and we removed some of the bone. There wasn't a lot of bone over the tooth. And we cleaned everything. After that, the orthodontist placed the chain. And then we just return the tissue back to normal. In this way, it's going to heal faster, the patient is going to have less post-operative discomfort, and then when we erupt the tooth out, the orthodontist is going to erupt the tooth slowly, and we're going to have a nice band of keratinized tissue underneath the canine, and we're going to maintain our mucogingival junction normal without disrupting it. So this is the technique of choice that I recommend. And my discussion now is only to this case. Every impacted canine or impacted tooth requires a different technique based on a lot of different factors. And you might have a different doctor that might recommend a different technique. The most important thing is to do what's best for the patient in order for them to have the least amount of discomfort and to reduce amount of problems in the future for the patient. If you have any questions, feel free to contact me.